Professor Emeritus, Department of Shalyatantra, STMCA Udupi, to take over the session. Welcome to you, sir.
Okay, thank you. Right, okay. In the last session, we had missed a few of the shlokas. That one of the shloka is about the production of the dhatus by time to time, the time gap missing related to the production of the dhatus. This was an accidental missing, like in the last minute. Anyway, we'll continue from that point now. For the each of the dhatu to get converted into the next dhatu, according to Sushruta, there are the time gap is mentioned as a Trini Kala Sahasrani, Panchadasha
Excuse me,
Kalaha, Ekaikismin Dhatu Avadishtade, Eka Mase, Eva Mase Narasaha,
excuse me,
Shukram.
sir.
Huh?
Sir, the
Oh,
screen is not visible.
screen is not visible. Okay, all right, I'll now try again.
Yes.
Is it okay now? Is it visible?
Yes, sir. Yes. Yes, sir.
Right, okay. Now, the issue is about the time taken for the conversion of one dhatu to the other dhatu. According to Sushruta, the time is 3 kala sahasra or 3000 kalas. 3000 kalas as per the our standard calculation, with the Vedic measure of mentioning about the time. The time duration for one kala is about 3.2 minutes. The time minutes of the Vedic literature is starting from Nimesha, Kasta, and Laghu Kala. 30 kastas are one kala. So one kala is around 3.2 minutes. That means for each of the dhatu, it's around 160 hours. That's about 6.6 days. That's how we can calculate it. Or and for each of the dhatu, once the rasa dhatu converts into rakta dhatu, it stays as rakta for Panchadasha Sahasraha, the 15,000 kalas, and that 15,000 kalas comes to around 33.3 days. So this way, at the end, time total time to taken for rasa to get converted into shukra is around 30 days. That's what Sushil says, but actually it's 33.3 days if you go by accurately. Like so, evam masat, 1 month is required. This is what Sushil says. Of course, practically, how far it is true, that's the next question. But if you look at the contemporary physiology, and look at the time taken for this, according to our hypothesis, like the duration taken for the conversion of dhatus. Now it's not a real thing, like, but as far as the known information about the physiology, if you look at the changes due to the fasting in bone, the changes in the bones would be seen due to fasting. By 4 hours, there will be no significant change in the structure of the bone, but it is only about the blood cells which reach to the area. By around 3 weeks, there will be really degradation of the bone. The contents of the bone structure will be released as such, and the bone becomes softer. So, the hypothesis what we can derive is the time taken for the nourishment to reach to the bone could be in the level of maybe around 3 weeks to the bone. So from that point of view, we may guess that whatever Sushila has said about the total time, maybe to a certain extent can be established with the contemporary science. But it's not that the contemporary science accepts the same theory. It's not that the one tissue is produced from the other. So I think that's what we have discussed in the previous session also. Like the issue is about a possible observation clinically that when you do the fasting, there will be changes in the tissues, and based upon that changes in the tissue, Sushruta has considered this as a possible the theory as such. Now, how the conversion occurs? Again, there is a bit of a difference of opinion. The conversion of dhatus would occur according to the Shabdasti Jalasantanabata Anuna Visheshena Anudhavati Evam Shariram Kevalam. According to Sushruta, the conversion could be either like a Shabda with the waves of sound, that's instantaneously it can change, or archi, like the flame where it goes upwards. So there will be a change from one to the other. Archi is flame, the flame as such. Jalasantanvata, or it could be in the horizontal direction from one to the other. So the conversion may occur in by changing one dhatu to the other or so on. Now Chakrapani has in Charaka has added some more about that information. That conversion could be either Kshiradhasi Nyaya, Kedari Kuli Nyaya, or Khale Kapota Nyaya, and this is how the Dhatu Poshana Krama occurs. Vagbhata has considered that Dhatu Poshana Krama also as a fourth of the Nyaya. Anyway, the idea is, the theory is either it could be like Kshiradhasi Nyaya, where the whole milk gets converted into the curd. Similarly, the Rasadhatu gets converted into Rakta, Rakta gets converted into Mansa, and so on. And this is how one possibility. The other possibility is a Kedari Kuli Nyaya, where once the Rasa is complete, the quota of Rasa is complete, that overflown Rasa would be reaching to the Rakta compartment. It gets converted into Rakta. Then again, the same would be moving further into the next compartment of the Mamsa, and so on. This way it may occur. So it's not that one dhatu gets converted into the other, but after completion of the one dhatu, the next dhatu is formed. This is the Kedarikul Nyaya. Or Khare Kapota Nyaya is where a specific substance reaches to the specific target based upon its quality. The Guna Dharma is the decisive factor. So this way, any of these theories could be the possible hypothesis of conversion of the dhatus. Of course, you cannot comment on the contemporary physiology, because from the contemporary physiology point of view, this kind of issue is not at all discussed, or it's not really observed as such. So we'll just consider this as one of the theories of Sushruta and accept as such. Now, the Kedarikula Nyaya, Kshiradhati Nyaya, it can be applied to the contemporary physiology in the situation of the transport of substances across the membrane. When there is a need, this is about not about the synthesis of the tissues, but when the nourishment reaches to the tissues across the cell membrane, the transport of the substances across the cell membrane, it could be either a diffusion or a assisted diffusion, where the substance will be converted into another chemical, and only that chemical passes through. That's the assisted distribution as such, or where there is a supported distribution, or it is the receptor based concepts. This receptor based concept is the Khale Kapota Nyaya, and a passive diffusion depending upon the concentration difference, that's the Kedarikula Nyaya, whereas the facilitated diffusion is the Kshiradhati Nyaya. So those theories are quite relevant in the context of the diffusion of the substances across the cell membrane, but not really related to the formation of the dhatus. Now, anyway, once this occurs, now the time taken for the conversion of rasa to shukra is considered to be 30 days, and probably there was a question in Sushruda's class then, how you consider Vadikarna Aushadhi? The Vadikarna Aushadhi, because of its quality, it produces this release of the shukra. So Vadikarna may not be increasing the quantity of shukra, instead it releases the shukra. That's what we have discussed. This shloka we have discussed in the last class also. वादीकरण औषधयः स्वबल गुणोत्कर्षात् विरेचनवत् उपयुक्ताः शुक्रं शीघ्रं विरेचयन्ति यथा हि पुष्पमुकुलस्थो गन्धः न शक्यम् इह अस्ति इति वक्तुं नैव नास्ति इति अथ च अस्ति सतां भावानाम् अभिव्यक्तिः इति ज्ञात्वा केवलं सूक्ष्मात् नाभिवेद्यते स एव विवृतपत्रकेशरे पुष्पे कालान्तरेण अभिव्यक्तिं गच्छति एवं बालानामपि वयपरिणामात् शुक्रप्रादुर्भावो भवति रोमराज्यादेश्च विशेषाः नारीणां the shukra dhatu is present in the younger age too, but it is not visible. Now that's what we have discussed. Shukra is not really semen alone. It's the reproductive capability. Reproductive capability is present in every cell. It's hidden in the nucleic acid of the nucleus, and whether the cell undergoes mitosis or meiosis, that's the decisive factor about the shukra. That's what we have discussed too. And ultimately, the final visible form would be either the semen or the ovum, which is seen in the later age of life in the whole body. Now, that's about what we have discussed till now. Now we continue further. स एव अनरसः वृद्धानां परिपक्वशरीरस्त्वाद अप्रीणनो भवति त एते शरीरधारणाधातौ उच्यन्ते. Now, if at all in the older age, because of the capability of the formation of the dhatus is reduced, the even if the anarasa is there in the older age, it may not really result in a proper formation of the dhatu. That formation of the dhatu could be affected due to the old age as such. तेषां क्षयवृद्धि शोणितनिमित्ते तस्मात् तदधिकृत्य वक्ष्यामः तत्र फेनिलम् अरुणं कृष्णं परुषं तनु शीघ्रम् अस्कन्धि च वातेन दृष्टं नीलं पीतं हरितं श्यामं मिश्रम् अनिष्टं पिपीलिका मक्षिकाणाम् अस्कन्धि च पित्तेन दृष्टं गैरिकोदकप्रतीकाशं स्निग्धं शीतलं बहलं पिच्छिलं चिरस्रावि मांसपेशीप्रभं च श्लेषं दृष्टं सर्वलक्षणसंयुक्तं काञ्जिकाभं विशेषतो दुर्गन्धि च सन्निपातदृष्टं द्विदोषलिङ्गं संसृष्टं. All the dosha dhatu, the formation of the dhatus, is dependent upon a proper status of the shonita, the rasa and the rakta together, the blood as such, and hence all our focus would be on the rakta as such, shonita as such, and the visheshan of the doshas in the body, Vata Pitta Kapha Dustis, they can be diagnosed, made out by testing the blood. And it is true that almost 90% of the diseases which we see now can be diagnosed or have some entity which can be utilized or which can be studied by assessing the blood contents. Different tests are done. Now you have now very advanced battery of the chemical tests, whereas Sushruta had suggested about the physical examination and to a certain extent a crude chemical examination. That's the by looking at the contents of the blood, specific gravity, its appearance. When the blood would be having dark color, blackish color, and it has a relatively thin consistency and hence flows easily, clotting is delayed. That's considered as Vatadushta. Whereas the color is blue or so on, bluish or yellowish color, and it has a relatively altered smell, or the insects do not prefer that blood, then it's Pitta Dushta. And when the blood has a relatively dark gray color, or it could be having higher clotting capabilities, thicker, consistency is thicker, viscosity is more, that's the sign of Kapha Dushti. And similarly, when there is all the features seen and the blood has a Kanjika, looks like Kanjika or pale color, this is suggestive of the Sannipata Drushti. Now, whether the same colors have to be used for the clinical diagnosis now, or should we use the current available advanced technology, that's the point. I always say that we have to make use of the advanced technology to make the diagnosis, and there is nothing wrong in it. It's not against the concept of Ayurveda if you use that advanced technology. Of course, those two technologies which are mentioned in this text also are relevant, but they may not be sufficient in the present day situation. In the present day situation, we have to make use of all those technologies available, and all those biochemical parameters which we now consider, they are just the extension of what Sushruta has suggested as the signs of vitiation of the Shonita. A normal shonita would be Indragopa Pratikasham Asamhatam Avivarnancha Prakristam Janiyat. It will have the color of Indragopa Brana, Indragopa this worm as such, and it has a proper clotting capabilities. Now, the next part is about the Vistravana, Rakta Vistravana as a treatment. Now, Rakta Vistravana as a treatment is one of the major measures used in the Shalya Tantra. And before we go into the details of Rakta Vistravana, Sushruta has said where the Rakta Vistravana should not be done. There is a precaution. Contraindications for the Rakta Vistravana are the first point to be discussed, then really going into the procedures of the Rakta Vistravana. That shows the sense of caution applied by Sushruta in the treatment of Rakta Vistravana as such. अत अविस्राव्याः सर्वाङ्गशोभः क्षीणस्य च अम्लभोजननिमित्तः पाणरोगी अर्शस् उदरी शोषी गर्भिणीनां च श्वेतवः. Patients who have edema in the body, where either it could be generalized edema, anasarca, or the patient's malnourishment produced the edema, due to the energy malnourishment, amla bhojana nimittah, because of improper nourishment, the edema occurs, or edema occurring as a result of the diseases like Pandu or Arshas or Udara. In these or Garbini, in these conditions, the patients who have an edema, the Rakta Visravana is a contraindicated. That's one of the major important issue. Before you go for the Rakta Moksha Chikitsa, ensure that the patient doesn't have a circulatory incompatibility. Edema is a sign of circulatory incompatibility and which could be produced due to any of the causes. And in all those conditions, Rakta Moksha is contraindicated, one of the first of the contraindication as such. More and more of the contraindications we will have in the next. So that's one of the important precautions suggested by Sushra. Now this sentence has a higher value because of the rather historical aspects of the bloodletting done in the Western country, a part which I will be trying to discuss in the coming due course of time. Now, Shastra Visravanam Dvividham Prathanam Sirabhidhanam ja, the technique of bloodletting with the instruments is either Prachana or Sirabhidhana. Jalavka we have already discussed in the previous chapter. Shringa and Alabu also to a certain extent we have referred to. More of that Shringa and Jalabu we will discuss in due course of time. So intervening mode of Rakta Vikstravana bloodletting are either Prachana where you make a superficial incision over the skin and or the Sirabhidha where you insert a needle into the blood vessel and drain out the blood. तत्र रुजु असंकीर्णं सूक्ष्मं समम् अनवगाढम् अनुत्थानम् आश्रित्य शस्त्रं पातयेत् मर्मशिरास्नायुसन्धीनां च अनुपघाति. When you the concept of that prachana, making the incision should be, there should be a clean incision made and a superficial incision which is uniform, and this incision should not injure the inner structures. A incision made just over the skin where only the partial skin thickness is injured and inside, and the blood should flow and it should stop by itself. That is a basic quality. And when you say that the blood should flow and it should stop by itself, the incision should not go beyond the level of dermis. It should be involving the epidermis and only a part of the dermis. The collagen tissue layer in the dermis is the elastic structure which can stop the bleeding once it is injured. If the incision is beyond the dermis, then the bleeding may not stop spontaneously. And when Sushra says that it should stop spontaneously, it means that incision should be to the level of dermis alone, not beyond that. If you go beyond the dermis, then that's not the proper depth of incision. Now, the incision, this bloodletting also should not be done based upon the other factors. Those are durdine. When there is a cloudy area or the environmental factors are not proper, then it should not be it should not be done. Or shita batayoho asmire. When the environment is cold, then too it should not be done. Bhukta matre. Immediately after the food also, the Raktamokshana should not be done. And Shrunitam Savati Alpam Savati. Madamurcha Shamatanam Vata Vinmutra Sanginam Nidra Bhuta Bhutanam Radam Nasrak Pravartane. Patients who have an impaired level of consciousness or who are extremely tired, and those who have a constipation or the flow of contents are not normal, or Nidra Bhuta Bhutana, where the person is sleepy. In such conditions, the blood doesn't flow properly, and hence it should not be Raktamokshana should not be done in such situation. Taddushtam shonitam anirshyamanam shofa daha ragapakavedana hajanayet. If the dushta shonita, the vitiated blood is not removed, it can result in local inflammatory signs. And so, if you make an incision and if the improper blood, vitiated blood doesn't flow out, it can result in inflammatory changes. This is what Sushruta says. अत्युष्णे अतिस्विने अतिविद्धे अग्नेः विस्रावितम् अतिप्रवर्तते तद् अतिप्रवृत्तं शिरो अभिताप आञ्झ अधिमन्त तिमिर प्रादुर्भावं धातुक्षयम् आक्षेपकं दाहं पक्षाघातम् एकाङ्गविकारं हिक्कारं श्वासकासो पाणिरोगं मरणं चापादयति. Signs of excess of blood loss. If it is if the technique is practiced by a person who is not skilled enough, and If this results in the complication of excess of blood loss, the complications mentioned by Sushra of the blood loss are Shirobitapa, headache, and Andhya Adhimanta, Timira, impairment of the vision. Now, this is very interesting issue. In many other contexts, when Sushra says about the consequences of the blood loss, he refers to the same point like there is a possibility of impaired vision when there is a blood loss. That impaired vision in a blood loss is something which is not really given due importance in the current physiology. In the current physiology or pathology textbooks, if you study the science of blood loss, that impairment of the vision is not really given due importance. But it is practically true that the persons would have an impaired vision as the first sign when the patient goes into shock. Any person, and in the conventional local term, the sign of shock or episode of fainting is also considered as a kannu kattale barudu. Kannu kattale barudu. The word meaning is where the person would have a blindness. So this has become a practice, but in the contemporary physiology or pathology textbook, you do not get this sign as a typical sign as such. So, which is practically true. Then Dhatukshayam Akshepakam, convulsive disorders are neurological deficits which can occur. That's quite true, like in a patient who has the blood bleeding as such. Hikkam Shasakaso Pandurogam Maranam Japadaiti. In due course of time, a chronic blood loss can result in the other systemic disorder where patient may have a pulmonary insufficiency, anemia, and so on. Now, hence, the precaution is tasman nashite natyusne na aswine na atibatite yavagum pratibhitasya shonitam mokshe bhishaka. The bloodletting should not be done in very cold season or very hot season, and should not be done without the svedana. Now, this is another controversial issue. In general, in practice, bloodletting is done without that pre-procedures or pre-operative procedures. Svedana or snehana is generally not done. Whereas in the contraindications or the specific indications, Sushra has used that word astrine. Though after the Svedana only, the bloodletting is to be done. But nowhere else, Sushra refers to that pre-operative procedure of the Svedana. Practically, in majority of the situations, the that procedure, pre-operative procedure, is not done during the or before the bloodletting. So, na atitapide in persons who have fever or the temperature is higher, yavagum pratipita shonitam mokshe vishaga. Only after having some light food like yavagu, the rakta moksha has to be done. सम्यक् दत्वा यदा रक्तं स्वयमेव अवतिष्ठते शुद्धं तदा विजयानीयात् सम्यक् विस्त्राक्तं च तत्. The proper signs of rakta mokshana is the blood should flow and then it should stop spontaneously. That's what we have discussed when you say that spontaneous stoppage of the blood. It means the incision should not go beyond the dermis level. So if it goes beyond the dermis level, a spontaneous stoppage may not be possible. Now, the signs of a proper Raktamokshana is Laghavam Vedana Shantihi Vyadi Veda Parikshaya Samyak Visravite Lingam Prasado Manasatsata. It results in a feeling of lightness. The disease process, the course of the disease will be slowed down, and the person would have a pleasant feeling, a comfortable feeling after the Raktamokshana. The diseases which can be prevented by Raktamokshana are Tadoshaha, Granthyashophaha, Rogaha Shonitajaste, Raktamokshana न भवन्ति कदाचन. The diseases of skin disorders, localized inflammatory swellings, Granthyashopha, etc. These are not can be prevented by regular Raktamokshana. Advantages of regular bleeding or blood donation are now known. I will come to that part later on. That's the one of the issues. But it is not that it is considered as a curative treatment in many of the diseases in the current practice. अथखलु अप्रवर्तमाने रते येगा शीत शिव कुष्ठ रगर पाठ भद्रता हिंगु चित्रक त्रिकटु आगार धूम हरिद्र कंकुष्ठ रक्तमाला रक्तमालफलैः यथारागं त्रिभिः चतुर्भिः समस्तैव चूर्णीकृतैः लवणतैलप्रगाढैः व्रणम् अवकर्षेत् एवं सम्यक् प्रवर्तते. If at all blood flow doesn't occur properly, then it can enhance by applying the tuna of these plants with the salt and then rub that area. That's one of the techniques suggested. Practically, it may not be really done as such. अतः अतिप्रवृत्ते if at all there is excess of bleeding, then रोधमधुक प्रियोग पतंग गैरिक सर्जरस रसायन शाल्मली पुष्प शंख शुक्ति माशय वगुधुमचूने शनि व्रणमुखम अवचून्य अंगुल्या अवपीडयेत. Now the angulyatrena अवपीडयेत. If there is excess of bleeding, it should be compressed. The compression is the first line of the treatment in such conditions. And for the compression, it may be facilitated with the tuna of such plants which have relatively shitavirya. Sala sarja arjuna arimeda meshashungi dhava dhanvatpaka वचूर्जाभिः क्षौम्येन धापितेन समुद्रफेन लाक्षाचूर्णेन यथोक्तव्रणबन्धनरूपैः गाढबन्धनीयः. Making use of an absorbent material like cotton or the samudrafena, and with the tuna of such drugs, you may apply a tight bandage. So compression is the first treatment. Then shita achhadan bhojanagarehi shitaihi pradeha parishekeshta upachareta ksharena agninavadhet yatoktam. The next part is about applying cold substances over the area and the cold, keeping the patient in a cold environment or locally cold also is applied. Ksharena agnina tadahet yathoktam. The last option is either use a kshara or with the cautery, the bleeding can be stopped. In the different contexts, Susha has mentioned about the techniques of the prevention of bleeding, sandhanam, skandanam, teva, Pachanam, Dahanam, Tatha. The four techniques of stopping the bleeding are Sandhana, where you apply the local application, and compression as a Shita Dravya is applied, and Skandana by applying the Shita Dravya, and Pachana by the Kshara, and Agnikarma, the last option is cautery, so that the bleeding can be stopped. So techniques of establishing the hemostasis are mentioned by Sushra, and they are absolutely practical even now. In any case of surgery or any intervention, if there is a bleeding, to stop the bleeding, we follow the same measures. The only extra would be we may have a ligation, artiforceps and a ligation in surgical practices. Tame atipravurtam siram vidyet kakolyadikvatam sharkara madhumaduram payet. Later on, if necessary, you may just again puncture the same vessel if necessary after the certain period of time. Susnigdesha asniyat upatravam shetaswam upacharet. The patient has to be given snigdha, and whatever the complications occur, those complications have to be managed. The systemic complication of a chronic blood loss are धातुक्षयात् श्रुते रक्ते मन्दस्सञ्जायते नलः पवनश्च परं कोपं याति तस्मात् प्रयत्नतः तं नातिशीतैः लघुभिः स्निग्धैः शोणितवर्धनैः ईषदम्लैः अनम्लैर्वा भोजनैः समुपाचरेत. So, if the bleeding occurs, if there is a continuous blood loss, the complication which would occur would be, it will result in Agnimanja, and as a result of the Agnimanja, there will be Vata Prakopa, and hence the treatment would be, the principle of the treatment would be Shonitavardhanihi, those hematinics, the substances which increase the quantity and quality of the blood, which are neither Shita, not extremely Shita, but Shita Virya and Laghu Guna. And there should be lesser amla rasa of the products, and such substances are used. Draksha is one of the ideal techniques. Now the same thing, Chaturvidham Edetati Rudirasya Nivaranam Sandhanam Skandanam Deva Patranam Dharanam Tata Varanam Kashaya Sandate Raktam Skandayate Himam Tata Sampate Bhasma Dahasam Kote Siraha. The same issue which I referred to just earlier. The technique of stoppage of the bleeding could be of four categories. Sandhana, that you apply locally, and compression. Skandana, the Shita Virya Dravyas and cold applications. Pachana, Kshara and Dahana, cautery. These are the four techniques of the prevention of the bleeding. Askandamane Rudhire, Sandhanani Prayojeta, Sandhane Bhrashamane to Pachane Samupajareta, Kalpaihi Etaihi Tribihi Vaidyaha, prayate tathavidi asiddhimatsu taiteshu dah paramijjate. So the preference would be the first of the thing would be the sandhana, and if it fails, then the pachana, and the dahana is the last. Agni karma is the last option of treatment there. Now, शेषदोषे यथा रक्तौ न व्याधि अतिवर्तते सावशेषे तु स्थेयः तथा स्थेयं न च कुर्यात् अतिक्रमम्. It's better to have a situation where the dosha is not completely removed. Unlike other shodhanas, where a complete removal of doshas is the priority, in Rakta Mokshana, it's not. You may have to leave certain amount of doshas left over, and this is for the safety. That safety precaution to avoid that excess of the blood loss is suggested by Sushra by ensuring that you are not removing the blood completely. Because the dehasya ruधिरं मूलं रुधिरेणैव धार्यते तस्माद् यत्नेन संरक्षं रक्तं जीवैति स्थितिः. The rakta itself is a jivana. The sustenance of the life is dependent upon the blood, and hence you have to be careful to ensure that the vitality is not affected. Hence, there should not be excess of blood loss as such. Sutta raktasya saikarye shitaihi prakrite anile Shopam Satodam Kosnena Satpisha Parishete. After the Raktamoksha, during that follow-up of the treatment and application of Loka, this application of the Shitalepas, it may result in a show of swelling, and that swelling, if at all there is a swelling which is produced due to application of the Shita Dravyas, Kosnena Satpisha, a warm ghee is used locally for the treatment. Now, the issue is something more. We will go beyond what Sushila has mentioned now. Bloodletting has been very popular in the Western medicine, rather more popular than what Sushila has said. In Sushila, when it is about the bloodletting, she has mentioned about the cautions, the indications. As I said, it's the contraindications first, and then the indications and the cautions to be taken, like where you should not go for the excess of blood. But if we go into the history of Western medicine, Celsius, who is considered to be father of Western medicine, his quote is to let blood by incising a vein is no novelty, but what is novel is that there should be scarcely any malady in which the blood should not be left. In the sense, should not be left. In the sense, every disease could have been was being treated with the bloodletting during the olden days. You will have plenty of literature in the Western medicine also, where the points of bloodletting and then the techniques of bloodletting are detailed. Maybe the information which you get there are much more than what Ayurveda would say. Instruments of different sorts are available if you go into history throughout the globe in every area, eastern or western. In the western, like France history, you'll get that instruments of this sort where bloodletting is done with the cupping, Chinese lancets, so on and so forth. The detail is quite huge. Ambrose Pare, who is considered to be the father of the surgery, she has given some extra theories. She has added certain concepts into the bloodletting. Earlier to Ambrose Pare, in the earlier, up to around 16th century as such, bloodletting was done irrationally, and for every disease it was considered without any rationality. Whereas Ambrose Pare is considered to be one of the persons who gave some rationality to the blood flow, and I have copied this paragraph from his textbook directly. Only thing is, I have just highlighted the indications. The indications are either to those who have trouble with the plenitude, who have an excess of blood, where there is a hyperemia, bloodletting is done, or for diversion or revulsion. If there is an abnormal flow, that abnormal flow to be diverted, or that is to elute or draw down, to reduce, stimulate the tissue to grow as such, or alteration to introduction of another quality, changing the quality of the blood. These are what Ambrose Pare has considered as the indications of the bloodletting, and the specific indications mentioned by the Ambrose Pare for the bloodletting are the quinsy, pleurisy, falling sickness, in the sense convulsive disorders, apoplexy, madness, etc. These were treated by bloodletting by RI. So, certain a scientific touch to the technique of bloodletting was given by RI, and still it was popular. But there was a downfall of the popularity of the bloodletting, and that again is a very important historical fact and which we should be aware of. America also, Western country America, it was very popular. Bloodletting was a very popular choice of the treatment, and almost every disease was being considered, and virtually there was no limit to the quantity of the blood. There would be no hesitation to remove the blood within an hour of 48 to 70 hours till the patient has shown the relief. Now, this has resulted in a major accident, and that major accident is George Washington, first president of America. He suffered due to epiglottitis and roughly around 3.7 liters of blood. Again, I stress upon that the quantity of the blood removed was 3.7 liters of blood was removed in a span of 10 hours, and he died on 14th December 1799. Now, a American president dying due to the bloodletting, after the bloodletting, this was a matter of discussion, and for many years this continued. And in 1965, Edinburgh Conference, it confirmed that the cause of death for his condition was the excess of blood loss, and from that point of onwards, 1905, of course, the bloodletting was a became unpopular as such, and that kind of a popularity has been reduced. And in the current situation, bloodletting is limited to a few of the diseases like polycythemia, where the viscosity of blood is increased and it has reduced, or chromatosis, hyperchromatosis, where the RBCs are having higher pigment, and very limited few conditions, bloodletting is considered as a treatment. Whereas a regular blood bleeding for blood donation, where you reduce the remove the around 400 ml of blood at regular intervals, it has shown some many advantages, and the most advantages of the regular bleeding for the or blood donation are a better lipid profile in the body, and stimulation of the hepatic enzymes. These are established factors, and these advantages are well known as such. In the whether the another question now, of course, whether the concepts of current physiology support the ethics of Rakta Moksha. It's very difficult to say substantiate that the current technique is a current physiology supports that technique. But what we can observe is the persons who do that have that regular bleeding, they have the advantages of either reduced risks of coronary disorders, and it ensures a better regulatory lipid profile, and reduces iron storage, reduces risk of cancer, and stimulates liver enzymes. These are considered to be the advantages of regular blood donation. So that's the only hypothesis by which we can say with the current knowledge. But one of the important things which we have to remember is irrational use of bloodletting has led to the downfall of the whole technique. And as an Ayurvedist, we should remember the cautions mentioned by Sushruta, and use these techniques only when there is a specific indication. Some of the leading articles which are presented now about the advantages of the bloodletting and the other issues, I have given you the list of those references. Those who are interested, they may read these references, where some of those advantages of bloodletting are presented, and the information you can get in detail over that. In the present situation, as I said, the limitation is about the standard protocol of bloodletting as a treatment is done in hemochromatosis, polycythemia, and parvoiria. Or certain of those indications, new indications may come are in hepatitis C, diabetes mellitus, insulin resistance. These are other where certain advantages are considered, but still they are not the standard protocol of the treatment. If at all you want to have more literature, more information about that, you may see these references. That's about the bloodletting aspect. With this, we conclude. इति सुश्रुतसंहितायां सुतस्थाने शोणितवर्णनीयं नाम चतुर्दशोऽध्यायः. The concluding is considering Rasayan Rakta as a different constituents of blood is based on very rational clinical facts. Rakta motion as a therapeutic measure was universally accepted, but 12 from raised due to irrational overuse. Judicious use of this technique can be very useful tool in clinical practice. With this, we'll conclude today. If there are any questions, I will try to answer then. bloodletting in person with edema is contraindicated is because he will have hypovolemia. Yeah, there will be, see, edema itself is a sign that there is a vascular incompatibility. The blood circulation is not proper. So in such a condition, intervening can be harmful. That's the idea of Sushruta, right? Okay. Sorry. Any other questions? Like, what is your view on choosing Raktamokshan as a treatment in Tok dosha? Of course, mm, see, in Tok dosha, Rakta Mokshana can be done, but what I have observed is it's not that much advantageous as such, as we have seen. Any chronic eczemas, these leeches, jalokas, they are shown to have some benefit. But I have uh, seen people using this in varicose veins and so on, but that's not really advantageous. There can be a temporary relief, but in the long term, as I have seen, in the long term, bloodletting doesn't produce a significant benefit. Temporarily, the signs of inflammation is reduced, but there is a possibility of recurrence. It's not that it results in a complete cure. Then there is another question: drugs which are mentioned for external application in case of less bleeding or over bleeding, can they be used internally for clotting? No, that's not the issue. It's for only the local uses. These drugs are mentioned for the local uses only. It may not be true that by giving those drugs you can produce a systemic changes. And the systemic changes, if at all you have to administer the drug systemically, it should be based upon the impact of the pitta dosha, pitta and the rakta pitta like conditions. The indications are Shitavirya dravyas. Of course, some of the drugs are common, but I don't think that the same theory can be generalized. Right. So, there are no more questions. No? Right. So
Thank you,
as,
sir.